My name is Dr. Chris Geddes, Professor and Chair, University of Maryland. I've been working with Lacriscience now for about 4 years, developing what I think is the world's smallest, most reliable and accurate portable diagnostic device that literally will fit in the palm of your hand. Lacriscience is a very typical startup company. It's had a lot of bumps in the road in the early years, but lately we've had a tremendous amount of success, particularly in the last 12 months, and it's that success that I'm really here to talk about today. The LacriPen is an osmometer primarily. In other words, it can diagnose dry eye by measuring the tear osmolarity, which increases the function of dry eye. We do that by using a technique called surface plasmon resonance, and the surface plasmon resonance technique can basically measure minute changes in the refractive index upon a very thin gold film, and it generates basically a small black line, which we call the reflectivity minimum. And that reflectivity minimum moves as a function of the tear osmolarity in the eye. Typical SPR, surface plasmon resonance techniques, they generate one line. Our optics are so advanced that we can generate multiple lines, which enables the device to self-calibrate in air. We don't have to calibrate using solutions. It self-calibrates by literally turning on the pen within a few seconds. The device, as you can see here, is an aluminum chassis. It has LEDs in the back of the pen, which is the orange box at the back. The LEDs are low power. They generate enough light that travels down the pen. It falls incident on the cap, which is at the top of the pen, which is disposable, and then forms an image line, basically a black line, on the image sensor, and it's this black line that moves, and our algorithms are able to determine the movement of this line and then effectively the tear osmolarity. This is what the optics look like inside the pen. They're extremely high precision and accuracy, and you can see an actual pen with optics in the bottom right-hand corner. We have a disposable cap, which is our razor blade model for the company, and you can see that in the top right-hand corner. I actually have one on my thumb here, on my finger here. They are very small, they're disposable, they cost less than $1, and on the surface of this disposable cap, you can see this very tiny gold film. We have developed a tear osmometer with the pen initially. We can detect tear osmolarity in the range of about 260 to 400 milliosmoles. We have an osmolarity resolution of about 2 milliosmoles. We've also developed an MMP9-based sensor that also fits on the top of one of these little tiny caps. We can detect MMP9 from in a dynamic range of about 1 to about 100 nanograms per milliliter. As you all know, the basal level is about 5 nanograms per milliliter. It's worth noting that there are some devices and lateral flow assays on the market that can detect MMP9. They have LODs around 40 nanograms per milliliter. Again, I'll note the basal level is about 5 nanograms per milliliter. Our MMP9 resolution is currently about 5 nanograms per milliliter, so it's pretty accurate. We have a very strong and expanding IP position. We have complete freedom to operate. We have patents issued and patents pending. Our business plan, how are we going to make money? Well, we're targeting primarily the US market initially, about 30 million humans in the US with dry eye. Remarkably, there is an enormous amount of animals, cats and dogs with dry eye, and because our disposable caps are very inexpensive, we think we have a great opportunity to penetrate that market as well. In terms of diagnostics like MMP9, adenovirus, MMP9, herpes zoster, herpes simplex, we think there are about 3 million diagnostics that we're going to target, and again, in general and veterinary science, we think there's about 10 million potential customers there. The LacriPen costs about $400 to make. We're going to sell it at about $1,400 per pen, and these numbers are approximate. The osmolarity sensor is about $1, so this disposable little cap on my finger here is about $1 for us to make that. We're going to sell that about $6. We think at such pricing we'll have enormous penetration into the market within about a year from now. The diagnostic sensors are a little bit more expensive. They're about $1.50 for us to make, and we intend to sell those for about $7.50 a test. Our timeline for success, we expect the pen to be fully completed by June of this year. August, we'll complete our laboratory and our basic clinical work. 510K submission by November, and December, the complete development of our pre-manufacturing schedule. We are looking for fundraising to go into our clinicals at the moment, should anyone be interested. At the bottom of this slide, you can see an actual rendition of the LacriPen. Thank you.